Patellar tendinopathy is a general term used to describe injury to the patellar tendon. The patellar tendon is a flat band of tissue that stretches from the base of the patella to the tibial tubercle on the knee joint. When the patellar tendon is mechanically overloaded, inflammation and degeneration can occur, resulting in pain when jumping or running, as well as tenderness on the tibial tubercle. It's the most prevalent injury seen with volleyball athletes due to the constant eccentric loading of the knee joint from repetitive jumping movements, and it is observed in 40 to 50% of elite players. This can be classified as an overuse injury from the continuous microtears that degenerate the tissue over time, rather than one acute incident. The sport of volleyball is characterized with powerful movements that indicate high levels of force being produced. This elevated force, combined with the frequency of jumping and landing, as well as a hard playing surface, all contribute to the overall inflammation and degeneration of the patellar tendon. Management by providing compression around the patellar tendon can alter the angle of the tendon in order to divert forces away from the specific area that's being overloaded.
Have the athlete standing in a tandem position with their injured leg's heel elevated 2 to 3 inches off the floor to contract their calf muscles. Make sure the athlete bends the knee at an unlocked 30-degree angle to lengthen their patellar tendon. This step is crucial as the tape will be going around the entire circumference of the leg. The athletic therapist will then check for DCAP to BTLS, CMS, and confirm that the athlete does not have any allergies to adhesion spray and lightly spray the area that will be being taped. The AT will then palpate the tib tubercle and the inferior aspect of the patella. Once palpated, a layer of 2-inch non-tear elastic tape will be applied between the tib tubercle and the inferior pole of the patella. It can be taped either medial to lateral or vice versa. The AT then will apply zinc oxide tape starting just behind the lateralmost aspect of the knee between the two joint lines. Once the strip reaches Gertie's tubercle, begin twisting the tape so it becomes a thin strip that will press on the patellar tendon. Make sure the athlete is pressing into the tape while the tape is being twisted. Stop twisting when the tape is in line with the Pezan-Serine group. You can repeat this process 2 to 3 more times depending on the size of your athlete. After applying your twisted strips, apply another layer of zinc oxide tape anchoring the tape behind the medial aspect of the knee. Then wrap a layer of zinc tape around the entire tape job to keep it down. Finally, wrap another layer of 2-inch non-tear elastic tape around the tape job to prevent it from falling off. Things to avoid are taping the patella and taping too high/into the joint space of the knee, as it can restrict the athlete from achieving the ideal amount of knee flexion. This is especially for volleyball players as they require a deeper angle of knee flexion to reach an optimum height in their jumps and movements. The final steps are taking the athlete through knee flexion and extension and see if the pain is decreased during jumping and other provoking mechanisms.